So Limbo lands when people come across my door and I'm talking to them about how they feel and about what's going on. I think first of all there's a sense of being powerless. They're caught up in a process that they don't necessarily understand. There's a sense of needing to place their trust in a system and their trust in a group of people they've never met. And often there are things that they hear or read that don't reinforce that trust, and there are things that they hear or read that make them have less of a trust in that system. So it can be exhausting because people are often thinking something might have gone wrong with the system. So it's a process of feeling lonely, of feeling as though there's very little power over what's going on, and it's a system which often is really good at giving you a technical answer very quickly. You know, yes or no, have you got cancer? But we're still learning about how to look after people in a way that makes them feel loved and cared for. And I think, you know, all of those things in terms of kindness and care are free. But often patients will tell me that people are very busy and they don't want to, you know, people often say to me, I don't want to waste your time, doctor. And I think, but I can always offer you a bit of kindness because it doesn't cost anything. So there's that feeling, limbo land, of just being very alone and waiting in a way that you don't have any control over it. So when I first have those conversations with patients about what to expect, and at that point of referral, I think the most important thing is to be as clear as possible from my point of view, so that people are under no uncertainty that they are being referred for a particular reason, which is to make sure whether or not they have got a cancer. And sometimes these conversations are difficult because patients often want to be reassured, they want to be told that there isn't anything to worry about, and sometimes you do have to say, well, we don't know that, we need to make sure. And I think part of the process of that referral situation is that people need to be aware of timeframes. So people need to know when something's going to happen, and if it hasn't happened by a certain time, that we would follow that up and we would chase that up. I'm pleased to say that 99 times out of 100 everything happens exactly as it should and when it should. But when we do those referrals, we'll often say to people, you know, if you haven't heard within a couple of weeks, just let us know, and we'll often give people a phone number as well to call. Often people they tell me they're expecting to see a specialist, you know, and quite often the first thing they'll do is they get a call to say, we'll book you in for a scan or we'll book you in for a test. So quite often people aren't, you know, that's the surprise. So I try and remove all the surprises, but often there is a wait for these things, and I think people often phone and they say, well, is it normal to be waiting 2 weeks? And I say, well, yeah, yes, it can be. But I'll often say to people, it's the waiting which is probably worse than the knowing in many respects, because once we know what we're dealing with, we can have a plan. And I think part of it might be preparation. So if we're waiting for something, it might be working out what questions you want to ask or what you might want to know. Part of it is making a decision. It's only natural. A lot of people do something called catastrophizing. So they think, what's the worst thing that could possibly happen? And often it's important to only really be concerned about the sort of the next thing or the thing that matters, rather than thinking what might happen in a year or 2 years or 10 years' time. So having that sort of pragmatic approach to a problem, rather than thinking, you know, what's the worst that could happen or how bad will things be. You know, I think that lack of knowledge is something that is difficult because it's something that's hard to plan for. When people are confronted with this, I think often there's a sense of disbelief, and then there's a sense of feeling like you're very alone. You know, you're the only person to be experiencing this. And I think in a good way, lots of other people experience this, and they have lots of different reactions to it. And I think when people find out that other people are in similar situations and going through similar situations, they feel a bit less alone, and that's at every stage of the process, in terms of going through a diagnosis, but also in terms of going through treatment. And I think the important thing is, if somebody is thinking, I've got to face this and I don't know what's happening and I feel very alone, I think the answer is to reach out and to seek support, and there's always someone who can help, always.